Hello, I'm today going to be walking you through the prosection for a total hepatectomy specimen. So this is an animal liver, so the anatomy is going to be a little bit different from humans, but here is our anterior surface. So we're going to have our right lobe and our left lobe. Then we're going to be looking from the back. And here we don't have caudate and quadrate lobes like we do in a human. But we do have all of our vasculature and our structures from our porta hepatis that are easily identifiable here. So along the superior aspect up here, we have our hepatic vein margins. And remember, in humans, you may or may not have a segment of attached inferior vena cava on your total hepatectomy specimens. So here I have my hepatic veins. You may or may not ink this margin before we shave it off, and we'll be submitting that on FOSS. So here's hepatic veins. Then we're going to be looking in this kind of hilum area. This is our porta hepatis. So in our porta hepatis, remember, we have three structures. We have our hepatic arteries, which in these animal specimens are very, very small, but you can see there's kind of red, bright red blood coming out of there. So there's one of our hepatic arteries. Here's another small hepatic artery. Then right here, you can see we have our yellow kind of bile stained. Here's our bile duct margin. And then our third structure in our porta hepatis is our portal vein. So what we're going to do is shave each of those and submit them in our cassettes. So for our porta hepatis, we can submit those all together in one cassette. And again, those are going to be on FOSS. So here's our hepatic artery. Very small. Then we have our bile duct margin. I'm going to shave that. Submit that into our cassette. And again, these are all going to look different histologically, so they can all be submitted in one cassette. And then here we have our portal vein margin. Great, so that would be our porta hepatis margins in that cassette. Then we're going to come up here and we have a hepatic vein here. We have hepatic veins here. And we can go around and shave this hepatic vein margin. And it's okay that we don't keep our keep it intact since it's so large, but we're just going to shave this margin. And if it's too big, you can cut it kind of into strips and submit those. And again, we're going to be doing our true margin down. And again, you may or may not ink these depending on your site. So I'm going to cut this kind of into 3 strips and submit those in my cassettes. Okay, great. So we've now done all of our margins on our gallbladder. So now what we're going to do is check out our hilum and all of this fat. We're going to make sure that we palpate for any lymph nodes. On this particular liver specimen, I don't think we have any lymph nodes, but you always want to check thoroughly at your hilum because we know lymph nodes are essential for staging purposes. So now what we're going to do next is we're going to remove our gallbladder and we'll gross that separately. We'll create a separate prosection video for our gallbladder, but you can kind of use scissors and cut along. We remember that this part of our gallbladder is our serosa, and then underneath it's called our hepatic bed margin, which is adventitia, which is a true margin. So we're pretending to be surgeons today, and we're going to remove this gallbladder from the surface of our liver. So we're going to amputate it here, and this will now be our cystic duct margin. You can really appreciate that that's our cystic duct margin. And remember, when we have our gallbladder, one of our essential things we're going to look for is our cystic duct lymph node. So we're going to set this aside and we'll prosect our gallbladder separately. Okay, so now we have our total hepatectomy specimen. We've shaved all our hilar margins, we've shaved our hepatic vein margins, and now what we're going to do is serially section our total hepatectomy, and we're going to do it, you can serially section perpendicular to the long axis. So for this, we're going to get our long blades. We're going to very carefully place our long blade onto our long handle. Okay, so we have our long blade on here and we're going to serially section our liver. And anytime we're using our long blade, we want to use the entire surface area and avoid sawing and kind of just pull all the way. So here I'm leaving it attached by just a very small amount of our liver capsule here, just so that I can kind of maintain my orientation, but I'm going just about all the way through so I can look at my entire cut surface. So for total hepatectomies, we're going to serially section at about 0.5 centimeter intervals. And with each slice, I'm kind of checking out my parenchyma. And here, our lobes aren't fused, so it's going to look a little bit different on a human. Here you can see kind of my different lobes are creating different levels here on my serial section, but on a human one, again, all of our lobes are going to be fused and all of our segments are going to be determined based on our blood flow. So we're looking at our full cut surface, again, really getting down there so we can look at everything, continuing to serial section. And see, I'm using the whole surface area of my blade, making sure I'm cutting all the way through. Okay, so we're going to now look at our entire cut surface, and we're going to say that this liver is received for a systemic process, not for a tumor. So we're going to make sure that we're talking about our outer surface here. It's nice and smooth and glistening, but if it were cirrhotic, we would comment on the nodularity. We're looking at our entire cut surface, looking at each of our slices, because we know we can always find incidental lesions on liver transplant specimens. I'm going to give this another slice so we can look at its cut surface. Great. And you can see here, here's all of our vasculature in our liver. So when we're talking about staging for liver, we're always going to talk about its relationship to adjacent vasculature because that's important for staging. Talk about our relationship to our porta hepatis, our hepatic vein margins, its relationship to the overlying capsule. So our cut surface here is nice and uniform. Okay, so see this slice I didn't quite get all the way through, so I can go back, section a little bit further, really make sure that I'm thoroughly examining my entire cut surface. So if you receive a liver for transplant and it's for something like cirrhosis, we're going to make sure we don't find any incidental lesions, and then we're going to do representative sections. So we're typically going to do 3 from the right, 3 from the left, and then some from the caudate and some from the quadrate. So how to take sections of rep sections is we're going to, again, take any areas that look different, any areas that look more fibrotic than others. We're going to make sure that we extensively sample those. So what we can do is just use our forceps and cut kind of our nice thin sections. They're going to fit beautifully inside of our cassette. And we want to make sure that some of our representative sections contain liver capsule. They have some of our vasculature, just so that we're adequately sampling everything that we see. So this is a liver for a process for transplant such as cirrhosis. And then we'll also go through a liver wedge prosection for a tumor. But again, you're going to have all of your hilar structures. You're going to have your porta hepatis, then your hepatic vein margins. Then you're going to do extensive sampling from each of your lobes.